Hi, I'm Tamara Cinnamon, and this is your Sutton Scoop. I'm here today with Nicole Shortt. She's with the Balanced Natural Health Clinic in town. So you are a naturopath?
Yeah, I'm a naturopathic doctor.
Not naturopathic doctor. Okay,
Yeah.
so tell me, what does that mean?
Well, naturopathic doctors are primary care physicians, so we do assessment and treatment plan. We're trained in physical exam, laboratory assessments, history taking, but the therapies we use are all non-drug therapies. So we use herbs and acupuncture, homeopathy, nutrition, lots of lifestyle dietary changes. I also do a therapy called Bowen therapy. So we use whatever natural means we can in terms of in the interest of getting to the root of the problem and treating whatever health concerns people might have.
Very interesting. So what would you use for assessment tool?
We use blood work, so we can order lab testing that's required. We do some saliva hormone testing. We use blood to determine food allergies. We do physical exam, as I said, and just base a lot of it on the history, family history, and their individual health history.
Wow.
And some urine tests, so for example heavy metal, some heavy metal tests, or we can do some different types of urine tests to assess thyroid or metabolism.
No, that's interesting, because I think a lot of people who don't know anything about it kind of just think, they just walk in and you're just saying, picking something out of a hat and going from there, that it's not, these in-depth tests. So what would be the age demographic that you're finding these days that are using a naturopathic doctor?
It's quite a range. I have a lot of families in my practice, so I have pediatric population to older kids, teens, and lots of young families. Yeah, I find women tend to veer towards healthcare in general, so especially natural medicine. And then I also have a lot of seniors who are coming in because they're finding that sort of the drug therapies are taking its toll on them or just not being effective.
Well, and it does, right?
Yeah.
After a long time. So are you finding that it's growing in popularity? I find that I hear about it way more than I did even 5 years ago.
Yeah, definitely. Yeah, I think people really are looking for an alternative. They're looking to kind of stay healthy and look for prevention and look for natural means of treatment wherever possible, so they can really minimize that exposure to drug therapies.
Yeah, that's fantastic. So last question, with your practice, what is your focus? Are you collaborating with the medical doctor world, or are you trying to stay independent? What are your thoughts there?
It depends on what the concern is for the patient. So in many cases we do work in conjunction with the medical doctor where necessary to really monitor it. We also will refer or consult if it's something that's beyond our scope. But primarily we do work on our own. We are trained to work independently in primary care, so where possible we do work on our own.
Excellent. And my last question, is it the type of thing that people come in like a regular checkup and they come in every 6 months and have an ongoing, or do you suggest more when they just have a concern that they're coming to you?
We do both. It depends on their health goals. A lot of people come in for prevention. We see them twice a year just to check in and see how everything is going. We do a lot of the time they'll want us to assess their supplement. So this is what I got from the health food store. What do you think? Is it, is what I read in this magazine really true? But we also have a lot of people that just come in for complaint-oriented appointments.
Sure, it's funny when you were saying, read this in a magazine. You must get that more and more and more with online. Thinking, you type in some sort of symptom. Next thing you know, you're going to lose your left leg, right? It happens so quick in a quick world, right?
Yeah, and it's very confusing. There's so much information out there, both online, in magazines, and what you find at the health food stores and pharmacies and even supermarkets now. There's a lot of health claims out there, and it's really good for us to have the background in science so that we can filter that information for people.
Absolutely. Well, I think we could talk all day, but I can see you're a very knowledgeable and valuable resource for someone. So if someone's wanting to speak to you or get a hold of the clinic, how can they get a hold of you?
Well, you can find us online. Our website is balancednaturalhealthclinic.ca. We're also on Facebook under Balanced Natural Health Clinic, and our telephone number is 545-0103.
Perfect. Thank you very much. I really appreciate it.
Thanks for having me.